Hi, my name is Tracy Durm. I work at Calhoun Community College. I am a nursing instructor. Today we're going to talk about central line dressing changes, IV flushes, and medication administration. When you come to lab to be checked off, these are the things that you need to know and do. The first thing is, as you approach the mannequin, you'll see an order. On that order, it'll give you an idea of what we're doing. This particular one has the patient's names, their allergy. It has the medication that we'll be giving, and it also has an order for a flush central line with 10 milliliters normal saline every 8 hours. That's what you need to know. So we are going to change the dressing first. The reason why we do that is it's the easiest part of this whole process, and you'll be doing that in this order when you come to your station. So the first thing we're going to tell the instructor is that we are going to validate our order, and then we'll go in and see the patient and make sure that we have the right patient, we're doing the right thing for the right patient. So we introduce ourselves, identify the patient, and let them know what we're going to be doing. We'll be doing a dressing change on you, Miss Bowman, and we'll also be giving your medication today. So the first thing we want to do is wash our hands. Once we wash our hands, we need to apply gloves, which will be in the room, probably in a box. When we go into the room, we need to make sure that we have the equipment that we're going to be using for the dressing change. And that will be your dressing change tray that came into your, that came with your nurse pack. And it'll look like this. It'll say dressing change tray. This one has a ChloraPrep in it, and I'll go over that in just a minute. So we've got our gloves on, we've washed our hands, we have our equipment. So we need to open our tray. The very first thing you should see is a mask. That will prompt you that we need to wear a mask. Why do we need to wear a mask? Because this is a sterile procedure. So after we've applied our gloves, we want to make sure that we don't give the patient anything that we've brought in with them. So there's two things you can do. One, you can put the mask on, which you'll have to wear a mask. The other part is you're going to put a mask on the patient if they can tolerate it. If they have shortness of breath or those type things, they cannot tolerate a mask. What we're going to tell them to do is turn their head to the side, away from the site. So we will put our mask on. And since I have one mask, I'm going to tell my patient in the position of comfort to turn their head away from my site. The next thing I want to do is remove the old dressing. Now I'm not going to take this one off of this mannequin because it's pretty messy. But we'll peel, and as you can see, all it is an op site. So we will peel away the old op site carefully. We don't want to pull out this line, so be very careful with that. Throw it away. Take our gloves off, throw them away, wash our hands again. The next thing in our tray should be our sterile gloves. This is a sterile dressing change. Therefore, you should be able to put on sterile gloves at this point. So we apply our sterile gloves. Okay, so we are ready. What you'll note in your tray is the ChloraPrep. That's what's stated on the outside, and this right here is the ChloraPrep. Now it has the wings on it, and in order for you to get the solution into the sponge part, you have to push the wings in. I'm not going to activate this one because it will just make our mannequin messy. But I would push these in, it breaks the cylinder in there, puts the ChloraPrep in this spongy part. The way that ChloraPrep works is by friction. Now, what we need to do is not hurt the patient, but we need to use enough friction in order to clean. So we're going to use what we call kind of a grid, a back and forth grid. We want to make sure that we cover the whole area, but we're going to do back and forth and then up and down. And make sure that you get under the catheter. Once we do that, we want it to dry. Do not put that back in your tray. Throw it away. Now, if you want to, you can use your sterile glove paper as your trash can at the bedside. So the next thing we're going to do is, after it's dried, we are going to put another opsite on. Now, some hospitals are going to be a little bit different, and they may use some different equipment. Most of them, however, will use the ChloraPrep and use this opsite. Now, there are some that have alcohol swabs, or they may even have providone swabs. Now, if they do, all you're going to do is wipe with the alcohol first, then the providone. Again, this is not common anymore, but if you should see that at a hospital, that's what we're using to clean with. Most of them use the opsite. The other part is, sometimes in the bottom of your dressing change kit, you'll see a button, and what that is that it's got a gel inside it that has antibacterial solution in it, and that button fits around the site here. So if you should find that in your dressing change kit, all you do is slide that button around the opening. Then you would apply the opsite over that. That's it. Now, there is a peel and stick part. This part of the opsite allows you to put your name, the date, and the time it was changed, because these will be changed quite frequently. And so we'll peel this off, and as you can see, they've already applied one here, and it would just have your name and the date and the time. Okay? So now you're ready to, you can take off your mask, because now we're not having to be sterile anymore, because it's clean and we've already put a dressing over the site. So I'm going to take this off. So now we can do our medication administration, and you can just keep your sterile gloves on it. That's not any big deal. So what we need there is, again, you've got your order. We've verified that we have the correct patient. And you want to do all of your 6 rights. The right drug, right dose, right client, right route, right time, and the right documentation. So we will document this after we leave. We have Lasix, and we're going to be pushing Lasix through this port. This is a single lumen. This is a single lumen. This is a double lumen. Now, these are all different types of ports that we can give medication through. You can't see this one, but this is a portacath. It has a administration site under the skin. So you would actually penetrate the skin, and your needle would then go into this port here. It has a silicone resealable covering on it. So when you stick it in and take it off, it reseals itself. That's used for very long-term IV therapy for years. It can stay in for years. This and this is called a PICC line. It's a peripherally inserted central venous line. Now, what they do is they find a really good vein, and they insert it under fluoroscopy in the x-ray department into that superior vena cava. And this is going there also. So basically, you have a line that goes into a very large vein. We can give lots through that line. High-powered medications, chemotherapy, TPN, all those things. So that's why we use those. But for now, what you need to know is how to flush and how to give medication. You're going to need some alcohol. You're going to need your medication, your syringe with your needle, and 2 flushes. For your purpose, everything will be done with a 10 cc syringe. The main thing that you need to know is that every hospital has different types of ports or locks. These needleless caps, there's different types in every hospital. And therefore, you have to do it in the way that the product or the company says that you need to access it. So each place is different. So the very first thing you're going to do before you go to any patient and access a line, you're going to pull their policy to see how we're supposed to do this. But just for your benefit of nursing school and having to be checked off on this, we're just going to do it in this way. You're going to take your alcohol, you're going to clean your port. Now, when you do this, you need to tell the instructor you're going to clean it for 10 seconds. You're going to do 10 to 15 with the alcohol. And then you have to let it dry. Once you do that, we need to make sure that this line is patent. So, we take our flush, screw it on, make sure you've screwed it on tight, undo the clamp, and you want to pull back. When you pull back, what you need to see is blood return. You see blood return here, you know that it's patent. It's where it's supposed to be. So once you see a blood return, then you want to inject the saline slowly until it's almost out. Let's say about a 1 cc. As you're injecting it, when you're finished, clamp this off. So it kind of has a pressure behind it while you're clamping it. That's an old clamp. Here we go. Now leave this on. You've already cleaned the site for 15 seconds, and as you know, that took a while. So we're going to leave that on because it's still sterile. The next thing we're going to do is we're going to draw up our medication. And you know how to draw medication. I'm not going there. So I'm going to draw up some medication, and that's what we're going to infuse. So you take this one off. It's clamped. Don't let the end of your port touch anything, because then it would be contaminated. Now, what we need to do is just, it depends on what you're giving as to how fast you can push it. This is Lasix, so it goes in about, it's 1 milliliter a minute. So we're given 2 mLs, that's going to be over 2 minutes. Okay? Once you finish, again, you want to unclamp it, push the medication in. Before it's totally finished and you still have pressure, clamp it back. Now, again, we are going to not have to wipe again, so we're going to go from one to the next without letting anything touch my port. And then we're going to flush. Now, the main thing here that you tell your instructor is you're going to flush the same amount of time that you had to push your medication in. So if you had to push your medication in 1 cc over 1 minute, guess what I'm pushing my flush in? 1 cc over 1 minute, because you still have all this medication in here. And we don't want to give it fast if it's not supposed to be given fast. So again, we unclamp, and I'm going to just slowly inject. You will have to give all of the 10 mLs in here. You need 10 milliliters of normal saline in this port so it doesn't clot. Now, what happens if I start to push and I hit resistance? I'm not able to push it in very easily. Do not force it. There are declotting agents that the physician can order. Do not force anything into a central line, because you could be pushing a clot through and it could go right into the lungs. So you have to be very careful with that. If you're trying to withdraw blood and it's not coming out, it could be clotted. So in that case, you would then call the doctor to see if he wanted to use the declotting or not. Most of the time they have more than one port, and we'll go from using one and then it stops, or maybe it gets clotted off, to using the other. So most of the time we have more than just one to choose from, so they don't usually declot those. And that's it. So let's go through that one more time just real quick. I just want to make sure that you have all the steps down. The first thing that you want to do for your dressing change is wash your hands, right? Get all the germs off. The next thing you do is apply your gloves. The next step is to apply your mask, and that's where people tend to go wrong. You want to put your dirty gloves, or the gloves that you're going to be taking off your dressing with, on, and then you put your mask on. Have them turn their head away. Then you take off their dressing. Then you'll apply your sterile gloves after you've washed your hands again, and clean with the ChloraPrep. back and forth, friction, let it dry, apply your Opsite. It's as easy as that. As far as the medication is concerned, make sure you've checked your orders, make sure you have the right dose, right patient, right time, your 6 rights. You clean the port 10 to 15 seconds, put your flush on. We want to check for patency. A lot of people forget to do that, but the first thing we want to do is check for patency. So once you've unclamped it, you check for patency, which is nothing more than just trying to see blood. Okay, we want to see if you're going to get blood draw. Once you do that, you flush slowly with the saline. Clamp it back. The other thing that you want to remember, and maybe you want to verbalize, is that we need to make sure that we don't put any air in this line. So when you're using these flushes and they come like this, remember there's a little air bubble at the top. We want to clear it out first. Clear the air bubble first, because the instructor will get you for that one if you don't let her know that we're trying not to instill air into the line, because then it becomes an air embolism. Okay, if you have any questions, ask an instructor before you get checked off. That's all I have.